In the 7th week of the lockdown, the United Kingdom has now recorded Europe's highest number of deaths linked to coronavirus. We have overtaken Italy. That was the first country in the world to instigate a national lockdown to control the pandemic. Dominic Raab, the first Secretary of State, said the latest figures portrayed a massive tragedy, but he warned against making comparisons with other countries until much more information was available on all causes of death. Now, today's figures show there were 693 deaths linked to the virus recorded in a 24-hour period in the UK. That's in hospitals, care homes and in the community. That brings the total number of deaths formally linked to the virus to 29,427, which is second only to the USA worldwide. Now, experts say there are several key factors to be considered when making comparisons, including population size, different testing regimes and geographical spread. As our science editor, David Shukman, explains now.
Every so often there are grim national milestones. This time as the UK's death toll rises above that of Italy, making it second only to the United States, and with every figure a story of loss and grief. The virus never loses the power to shock, killing 3 members of one family within days of each other. First, Keith Dunnington, a nurse from South Shields, then a week later his father Morris and his mother Lillian, leaving the family stunned.
I'm still in disbelief a little bit. Keith's children are absolutely devastated, and then to lose their nanny and granddad, they're really devastated. My children are both absolutely heartbroken.
At today's government briefing, the latest graph shows how the death tolls are rising in different countries. The official numbers confirm that Italy has lost 29,315 people and the UK now slightly more at 29,427. If it does turn out that we are the country that's hardest hit in Europe, what's your reaction to that?
There are different ways of counting deaths. As we know, we've had that debate in this country. We now publish data that includes all deaths in all settings. Not all countries do that, so I'm not sure that the international comparison works unless you reliably know that all countries are measuring in the same way. And it also depends on how good, frankly, countries are in gathering their statistics. And our own Office of National Statistics is widely acknowledged to be a world leader.
There are important differences between the two countries. The UK has more people than Italy, and London is far bigger than any Italian city. On the other hand, the population of Italy is older and more generations live together, which increases the risk to grandparents. It's a complicated picture that's still evolving.
Everybody knows that making international comparisons in such statistics can be difficult, and it may be that will take some time to sort out, and this isn't over yet.
But all this raises questions about the UK's handling of the outbreak. The NHS has avoided being overwhelmed, a real success, unlike in northern Italy. But it emerged today that fewer than 300 people were put into quarantine earlier this year, at a time when 18 million arrived without any kind of screening. And testing for the virus got off to a slower start than in other countries, and that's now been officially acknowledged.
In the early phases, and I've said this before, I think if we'd managed to ramp testing capacity quicker, it would have been beneficial. And, for all sorts of reasons, that didn't happen. And I think it's clear you need lots of testing for this.
The numbers dying every day are now falling. The lockdown is working, but this comes as tens of thousands of people across the UK are now grieving. David Shukman, BBC News.
Well, the impact of the pandemic on some of the most vulnerable people in society is becoming increasingly clear. The latest figures from the Office for National Statistics shows that deaths related to coronavirus in care homes in England and Wales increased by more than a third in the week ending the 24th of April. That week, there were 2,794 registered deaths in care homes linked to coronavirus. That means a total of nearly 6,000 care home deaths up to April the 24th. Our social affairs correspondent Alison Holt has the latest on the care sector and the intense pressure it's under.
Tonight at Glen Abbey Manor Care Home in County Antrim, it was confirmed that 14 residents have now passed away after testing positive for or showing signs of coronavirus. Each death an individual tragedy, the personal loss that lies behind the weekly official numbers, and a distressing marker of how the virus continues to reach into residential and nursing homes across the UK.
We got to the care home and my younger sister was there at that time and she was looking through the window and it was like surreal.
At a Liverpool care home, Joe Brown only managed to see his mother Bertha from outside after she tested positive for COVID-19. She died a few days later. He doesn't understand why the virus wasn't mentioned on her death certificate, but those are questions for another day.
There was my mum, not 3 metres away behind the glass. And the care workers, again, were trying to get her to look at the window to see us, you know. And at one point, she lifted her hand a few inches. But I couldn't do anything. And I like to think I've been quite a strong person myself all my life. Felt totally helpless.
More than a third of deaths in care homes in England, Scotland and Wales were registered as linked to COVID-19 in the week up to April the 24th. But overall, the number of deaths in UK homes from all causes is higher than usual, particularly so in England and Wales.
Almost 4 times more deaths than we would expect to see at this time of year were registered in that last week. It's about 280% more deaths registered in care homes above that 5-year average, and that number is going up. And 35% of those mentioned COVID on the death certificates.
Once again, these official figures paint a distressing picture of the impact that coronavirus is having on care homes. I understand within days the government will set out a plan of intensive support for care homes in particular, including additional backup from councils and health services. With care providers still having trouble with protective equipment and testing, many see more support as overdue but vital.
We need more help from the government on testing, on PPE and financial support. And I think we need more help so we can reduce the deaths in care homes going forward. We need to be at the centre, not on the periphery.
For weeks, care staff have said they felt largely on their own as they tried to protect residents. The test of more coordinated support will be whether that changes. Alison Holt, BBC News.
With me in the studio is our health editor, Hugh Pym. Hugh, can we talk a little more about this rather thorny issue of making comparisons between the UK and other countries? What is your reading of the differences here?
Well, Hugh, it's certainly a sombre moment with a death toll nearly at 30,000 and ahead of other European countries. But of course, there are these caveats. London is 3 times bigger than Italy's biggest city, and like New York, is an environment where the virus might spread quickly. The UK's got a bigger population than Italy, and of course there are some issues around international comparisons. And the point's often made, the NHS has coped remarkably well in the circumstances. It hasn't been overwhelmed despite predictions. But one chart stood out. It's the one showing Italy 15 days ahead of the UK in this epidemic. Italy was one of the first countries to be hit hard, and yet the UK now has a higher death toll. And it comes on a day with more scrutiny of the government by MPs at the Health Select Committee with officials, and then in the Commons health questions with health ministers. Questions being asked respectfully. I think MPs from all parties know the government's had a very, very difficult job here in unprecedented circumstances, but questions being asked about, was the lockdown imposed too late? Shouldn't testing have started a lot sooner? We heard from Sir Patrick Vallance, the Chief Scientific Advisor there, that he thinks it could have been developed more rapidly and not stalled for a month or so as it was. So I think these questions can only continue from here.
Hugh, thanks very much again. Hugh Pym, our health editor.